Good morning, students. In this class, we are going to discuss about a respiratory disorder that is most common, most prevalent respiratory disorder. Okay, it is known as asthma or bronchial asthma. Okay. So we all are familiar with this disease, that is bronchial asthma. In this topic, we are going to discuss about these contents. That they are introduction, definition, classification, risk factors, pathophysiology, and symptoms. Okay. So in introduction, as I told earlier, that is, it is the most prevalent respiratory disorder. Okay, it is a non-communicable disease of airways, and it can affect almost all ages, but it is particularly seen in childhood. Okay. Okay, so that is introduction. Then coming to the definition, as per a guidelines, that is National Asthma Education and Prevention Program guidelines, that defines asthma. Okay, so asthma can be defined as a chronic inflammatory disorder of the airways. So asthma is an inflammatory disorder, that is chronic inflammatory disorder of airways. Because of that inflammation, there occurs some changes. Okay, they are airway hyperresponsiveness and also obstruction, airflow obstruction. Okay, all these results in some symptoms. They are recurrent episodes of wheezing, chest tightness, and breathlessness and coughing. Okay, so in this definition, asthma can be defined as a chronic inflammatory disease of the airways, and that causes recurrent episodes. Okay, repetitive episodes of breathlessness, wheezing, chest tightness, and coughing, and these symptoms are usually associated with the obstruction. Okay, airflow obstruction and also BHR, that is bronchial hyperresponsiveness. Okay, hyperresponsive to any stimuli. Okay, and this obstruction is usually reversible. Okay, in asthma, the obstruction, airflow obstruction is reversible either with treatment or spontaneously it will change. Okay, that is the definition. Okay, in this picture, that explains the difference between normal airway and asthmatic airway. This is the longitudinal section and bottom transverse section. Okay, so we can clearly identify the changes that are occurring in asthmatic airway. They are thickened and tightened muscles, that is smooth muscles, then inflamed airway wall, and also deposits of mucus. Okay, mucus are deposited inside the airway lumen. Okay, these are the changes that are occurring in the asthmatic airways. Coming to the epidemiology, actually it is the most common disease, and also 300 million people suffer from asthma worldwide. Okay, and also in Indian perspective, there are total 30 million asthmatic patients. Okay, and it can be affected at any age, but mostly seen in childhood. Okay, then come to the classification. There are so many different types of asthma. They are classified based on the various categories. But here we are going to discuss the basic and important two classification. That is, first one is based on etiology and second one is based on severity. Okay, in etiological basis, asthma can be classified into two types. They are extrinsic asthma and intrinsic asthma. Okay, extrinsic asthma can also known as allergic asthma or atopic asthma. Okay, that means for this extrinsic asthma, there will be an identifiable allergen. So it is allergic asthma. Okay, it is due to an allergic exposure or allergen exposure. Okay, but in case of extrinsic or non-allergic asthma, there won't be any allergens. Okay, but that may be due to some conditions like stress, exercise, etc. Okay. This is the first classification, that is based on the etiology, extrinsic and intrinsic asthma, atopic or non-atopic asthma. Okay, allergic or non-allergic asthma. Okay. So next classification is based on the severity. So based on severity, classified into four types, that is intermittent asthma, then mild persistent asthma, then moderate persistent asthma, severe persistent asthma. Okay, in that first case, intermittent asthma, there are symptoms, asthmatic symptoms will be there, but it will be less than 2 days per week. Okay, and also night symptoms also will be there, but it will be lesser, that is less than 2 times per month. Okay, normal functioning of airways will be there. Then in second case, mild persistent asthma, in that case symptoms will be greater than 2 days. Okay, but not daily. Okay, then minor activity limitation also will be there. Then third one, moderate persistent asthma, they occur daily symptoms. Okay, and also night symptoms are also usually present greater than 1 per week. Okay, and the last one is the severe one, that is severe persistent asthma. Here the patients suffer from the symptoms throughout the day. Okay, and also frequent exacerbations also will be there. Exacerbation means worsening of the symptoms or disease. Okay, so this is the classification. Next, coming to the etiology. In etiology, we know asthma is not a single factor disease. That is due to mainly due to the multifactorial reasons. Okay, that we can classify that factors into genetic factors and environmental factors. Okay, genetic factors means mainly the family history and also atopic nature, allergic nature. Okay, these are the two reasons in genetic factors. Another one is environmental factors, that we all are familiar with these factors, right? So what are the environmental factors? First and most important is allergen. Okay, what are the allergen examples? We are usually familiar. Okay, so they are pollens, dust mite, house dust mite, then animal dander, fur, etc. Air pollution also a risk factor. Then cold climate, tobacco smoking, exercise, especially in the cold climate. Okay. Then respiratory infection, some chemical irritants like acid alkali dyes, okay, like that. Then occupational irritants like metal industries, that is based on the occupation, like occupation in the industry, textile industry, mining industry, etc. Okay. Then strong emotions like stress, anxiety, and food items like some dairy products. Okay, then egg, nuts, shellfish, etc. Then drugs like aspirin, beta blockers. So these are the environmental triggering factors. Okay, this may vary from person to person. Okay, so these are the environmental factors. So etiology is mainly multifactorial and that include genetic and environmental factors. Then coming to the important section, that is pathophysiology. Pathophysiology asthma, mainly the hallmark. Before going to detail, we have to know the important hallmark of this pathophysiology. They are airway hyperresponsiveness. The individual airway become hyperresponsive. Okay, to the various stimuli. Then inflammation of the bronchial wall, increased mucus secretion, airway remodeling, etc. Okay, so in this pathophysiology we can say it as a immunological pathway. Okay, because that involve the activation of antigen presenting cells, immunoglobulin E antibodies, okay, then T helper cells, etc. All are coming in this pathway. So we can call it as immunological pathway. Now, this pathway include 2 phases based on the timing. Okay, at first that occur within 5 to 30 minutes. That phase is known as early phase. Okay, in this early phase, that is the immediate response after an allergen exposure. Okay, after an allergen exposure, they produce some changes in the airway. Okay, so that activate directly the immunoglobulin E. Okay, immunoglobulin E activated, so that there occurs the activation of inflammatory cell. If the inflammatory cell get activated, means there occurs the release of a set of inflammatory mediators, right? And that inflammatory mediators cause various changes in airways. Okay, here in this early phase reaction, at first they activate the IgE antibody, so that activate mast cell, platelets and macrophages. Okay, then that in turn release histamine, leukotrienes, prostaglandin, etc. mediators. Okay, so that there occurs the bronchoconstriction. Okay, then also the increased mucus production by Goblet cell hyperplasia and also vasodilation and edema. All these are due to the activation and release of chemical mediators like histamine, leukotriene and prostaglandins in the first phase. So narrowing of airways occurs. Okay, then come Coming to the symptoms, key symptoms, important symptoms of asthma. These are the important symptoms. They are wheezing, chest tightness, coughing, and dyspnea. Okay. In addition to that, there will be the tachypnea and increased mucus production, and this coughing will be especially occur at the night or at the early morning. These are the major symptoms of asthma. Okay.